Hi, Sarah. Welcome back from Orlando. I know you were just at the American Diabetes Association's annual Congress that just ended. And, look, our collective of agencies is deeply focused on the intersection of healthcare news and cultural relevance. And I think you'd agree that this year's meeting delivered in terms of those type of headlines.
Absolutely. And I think the biggest headlines that we saw out of ADA this year were related to glucagon-like peptide 1 receptor agonists, or GLP-1 RAs as we all know them. And of course, you and I are aware of the impact that they've had on the headlines in the mainstream media. But what we saw at ADA this year is that not only are these molecules critical for treating type 2 diabetes and obesity, but also that they have broad impacts on obesity-related conditions. Of course, type 2 diabetes and obesity are still a focus, even emphasized by the fact that ADA started their own obesity association this year. But what we're seeing is that the incretin class of molecules has impact on chronic kidney disease, fatty liver disease, heart disease, and even obstructive sleep apnea.
Right. Their impact beyond weight loss and care for diabetes is incredibly exciting, with the potential to impact so many more aspects of health.
Absolutely. And what's wild is that the innovation doesn't even stop there. I think I read that 27 new molecules were introduced at ADA this year, including ones, for example, that have the capacity to preserve lean mass while reducing fat mass. So it's a really exciting time to be in the field, and it's clear that we're in the era of the GLP-1.
Yeah, this is such an exciting and really game-changing time to be a communicator in this field. But I have to tell you, despite all this good news around the GLP-1s, I was really startled by the remarks from the opening keynote by Dr. Califf, the head of the FDA, about the state of diabetes care today. His key message was that chronic diseases in this country are getting worse, and the growing epidemic of type 2 diabetes, in his eyes, really is a public health failure. And, he explained that chronic illness outcomes, including those for type 2 diabetes, are deteriorating. And look, diabetes costs this country more than $412 billion annually. Look, a lot of this has to do with lifestyle choices, but, with the cost of care, lack of access in remote areas, and now the rise of GLP medicines for weight loss causing a supply issue, access really continues to be the critical barrier.
Definitely. Equitable access is so important. And even those advisors and faculty members at the ADA agreed. In fact, there was one panel discussion about who should be prioritized for GLP-1 RAs in times of supply shortage. And one panelist proposed that those with BMIs of 40 or greater, especially those with comorbidities, and younger individuals, those with, who are underrepresented minorities, should be prioritized. So access and affordability is really at the forefront of everyone's mind.
Yeah, so glad it remains that way. But anyway, one last thing I wanted to say about the meeting is that there was more good news, and that is for people living with type 1 diabetes. There was some new early stage research about the potential for a cure for diabetes. It's early in the pipeline, but it's showing promise.
Oh, that's exciting. I've had type 1 for a really long time, so I would love to have a cure.
Well, anyway, look, this year's meeting was one for the books. I can't wait to see what next year's Congress brings, and it's here in Chicago, Sarah, so we'll see you here next year.
Oh, great, Stephanie. We'll see you then. Bye.
Good, thanks. Bye-bye.